So, let's talk Pompe. My son was born in 2014, around July. And 2 months old, he was showing symptoms of these classic infantile Pompe disease. He was finally diagnosed at the age of 7 months old, which was close to the end of life expectancy with infantile Pompe children, if left untreated with ER. Children who are classic infantile don't make it past 1 without a treatment. Again, as you heard in the minor podcast that I've posted on this YouTube channel, I do talk about this and the stresses it came along with the diagnosis, which was quite, as a mother, young mother, vulnerable young mother, and a first child, was quite difficult. If you want to link to that, I'll add the link to that video. Another one of the like what the fuck moments of having a child with Pompe is the amount of times we've had tooths just going right into his lung, through his tracheostomy, straight into his lung. It happened twice in 1 year. It was ridiculous. And again, there's a picture of the surgeons, because I was like, it took us about 3 months to get taken serious, because he kept on having these respiratory episodes, so going grey, blotchy, and we did physio, cough assist, saline nebs, bagging. Again, you have to be trained for this, you know, no one can just do this, you know, it's serious. So after all that, we need to call the ambulance, because he'd still be grey, he'd be flat out, it'd be horrific. So, and we come back into the resus and they go, he's fine, I don't know why you've sent him, he's just had a secretion blockage and you guys should just go home. So we were like, well, that's not good enough, because this was going on weekly. Like, we go home, a few days later, the same episode would happen. And then we started to discuss with Alder is, does he need more nebs? Does he need more stronger nebs? 3%, because at that point he was on 3 hourly nebs every day for the whole diagnosis. So years. That was his old routine, his respiratory routine. And we were doing the 3% and the 0.9% on top of that. So we did the 3% at 12, and we were still keeping up with the 0.9% 3 hourly. And it sort of fixed it, but didn't fix it. It didn't really, it calmed it down. And then it just still, after about a week of it being settled and not having to go to the hospital, it just happened again. And we were just like, there's clearly something else. We don't know why. We don't know how this is happening. So it got to the point where, again, I had to fight and argue and look like the crazy mum, as we always do with children that are complex needs and ventilated. They did an x-ray and one amazing doctor was like, that looks like a tooth in his lung. And it was like, what? Again, there's a photo of the x-ray where the tooth is, and I've circled it so you can see it. It's insane. She's like, yeah, there's that looks like a tooth. You need to go to Alder and get it looked at. So he looked at it again, went to Alder and they were like, yeah, that's a very big tooth in there. And so we went for a surgical procedure. We went down the they were going to go down the mouth, but because he's got a locked jaw due to the muscle weakness, they needed to go down the trachea. So they went down the trachea to get to the lung. And again, there's a picture of it. They took a camera. I was morbidly, I wouldn't say morbidly, it just amazes me how things, maybe that's the way how I cope with the stresses of this situation, is I collect what we experience as a family, and it's just insane. And I just feel like, I don't know, these type of lives that we live, it's just not even talked about, obviously, because I feel like it is difficult, and I feel like families like us are struggling and just want to crack on and make those memories and then, you know, give that quality of life for our children. But I feel like there's not a lot out there, and it's just like very lonely. It's very lonely. It feels very isolating and very, and when you talk about this stuff, people just look at you like, what the hell? And it's like, okay, no. But this is a very educational from our, we're not doctors, we're not specialists, just to highlight that as a disclaimer. We're none of that, we're just parents of a child with complex needs. But it's sharing our experiences to help, hopefully, maybe, you know, understand with infantile pompe disease, because there's no research on it. There is research, but it's not enough, and it's not talked about, and there's no cure, and these children, it's starting to become more, because they're not in the heel prick. We are also kind of noticing there's more diagnosis recently of children. Like, I never expect it to be so frequent, but there's another child in our school who's got infantile pompe, and I'm just like, okay, so if it was on the heel prick in the UK, would it be more noticed? And it's quite horrific and scary. So this is why I'm trying to do this channel. It's not as constructive as I'd like, but I'm trying, I'm learning. I'm not there yet, but I'm learning. Yeah, they got the tooth out. Back to that subject. It was insane. It was eroding in his lung. It was getting to that point that it's been sitting there, and we'd been having these issues with my son's respiratory for about 3 months, and we weren't getting listened to, and these episodes were happening consistently for 3 months. That tooth has been sitting in his lung for 3 months. It's just very concerning, and it was not long after that he caught an infection, a cold. But again, it's just another bad experience with a child who's respiratory, that a nurse amazingly did, a band 8 nurse put a humidifier above his head and said that was okay. Didn't like how my band 3s said you do not put a humidifier above a vented person's head, you're going to drown them. But this nurse saw her arse, got snotty and said, I'm a band 8, you're a band 3, you didn't know what you're talking about. So my carer took a photo and said, great, okay, I'm going to take a photo of that. And it was like seconds later after that nurse realised what she'd done. She's a band 8, she should know better. You don't put a humidifier above someone's head. A humidifier is like condensation. So when you're on a ventilator with tubing, you need some sort of moisture, because if you just put air to breathe, it's going to dry you out, you're going to struggle, it's not great. So the humidifier is to create the humidity in the breath, which again creates water. So it starts at the bottom usually. Again, I'll try and find a picture for you. And then the tubing goes up into the throat of the patient. So the water has to sit lower than the patient, otherwise the water is going to be above the patient, and then it's following the tubes. It's going to go straight down into the tubes and into the throat. And then it was not long after that, he caught pneumonia, and all they were telling me he was going to die, and I was like, I was kind of worms going on there. So that was not fun. Again, that's a kind of worms I don't want to talk much on that channel right now on this. This is just about experiences, but I guess that's an experience because of, again, people just, I guess I just don't trust specialists. Maybe that's a biased thing because I've had a bad experience, but I do struggle to trust nurses, doctors, professionals. It takes a lot. I do trust some, but it takes a lot. I'm very defensive, and with reason defensive, from, sadly, it shouldn't, but a sadly bad experience. But yeah, tooth incident, that's an insane little one experience that was never told, that this can happen. But because of his weak muscles, his bones, his everything else is complex, and all the small stuff that adds to the pompe, it doesn't help. He's got his teeth fall out, so in the end it resulted into us, because it happened the second time, that we needed to remove the yankers. So we had these yankers to suction out the secretions, as well as catheters. Again, I'll see if I can find a picture to show you the comparison of a yanker and a catheter. It's it's these medical equipment that helps suction out secretions, and that some people, when they were suctioning him, was just going into his mouth, which was causing the teeth to fall out and dislodge, and then some can't really swallow properly. It was going through the trachea. And then I'll show you another PowerPoint. On the left image is the word that says RT is just an online reference of what a chest normally looks like with the heart. and on the side that hasn't got the letters RT, AP, erect picture is my son's. He's got all the wires, and you can even clearly see in the x-ray the tracheostomy. That shows the abnormal heart enlarged. It's just another you could see from our perspective the changes. At this point his heart did improve from originally when it's diagnosed. I don't have the original x-ray because I think at that time in my life I wasn't really thinking things and like documenting things at that point, but at that point his heart was much enlarged. It's another sign of infantile pompe. It's a big sign. So if you know if they do an x-ray and the heart is abnormally enlarged, it means that heart is doing everything it can to keep that child functioning and keep that child alive. So it works extra hard, so it's a muscle, so it gets bigger, and then it gets to the point now where in a year's time, no enzyme treatment, it will just cut out. That's it, and gone. That's a really shit way of saying it. Very nice, not nice. Yeah, it's just another one of those examples if you want to look at and compare. Like other conditions that are muscular, scoliosis is one of them. My son had never had like a naturally curved spine. It's just over time and due to the muscle weakness. Again, not just Pompe has this, there are other conditions. It's very crazy. This screenshot also shows the deterioration of the spine as the person gets much bigger, heavier. The natural weight is, when I'm sitting here on the couch, you naturally slump to one side. It's that time of the person just over years slumping and eventually causing that curve. We do have a memory foam, what's it called? Is it a memory foam? It's not a malleable. You just have a malleable spine apparently though. That's a good thing with a scoliosis. It's very malleable. You can manipulate him to sit up straight, which is a good thing, because that's why he has a wheelchair that is molded to his shape to correct the curve, and he does go in his wheelchair. He can tolerate about 3 to 4 hours a day in that, and then he just needs an hour rest out of the chair, put back, and try and keep that spine as straight but as also as comfortable as possible for my son, because we don't want to push him where it causes pain, pressure sores, and it's not, we've got to give him some quality of life. So that's why we keep to this routine. But it does require surgery eventually. I was told from my doctor when it gets to 70 to just over 60% curvature, they'd need to do major surgery to correct the spine. Again, everyone's different, every child's different, every diagnosis is different, it's all unique. Again, I'm not a professional, I'm just explaining my experience as a mother. From what I've experienced, is we can't operate on his spine because of the weak bones, and multiple professionals putting their input and experiences. They described it to me as if he was to have the surgery, the major 12-hour surgery of putting a rod into his spine, forcing it to straighten up, and using magnets to, when he gets older, he could get magnets to straighten it up to grow with him almost. It sounded really, really amazing, and it is amazing, and it does help other children. But they explained that if they were to try and work with the spine, their fear is it'll just crumble in their hands, which is a bit horrific explanation, but very factual. And well, again, trust the experts to a certain extent. I don't, but I do at the same time, especially with this type of stuff. And what we do day to day with scoliosis, living with scoliosis, is sleep systems. So we have a sleep system we put into his bed, so even if he can't tolerate his chair, he can get into his bed, and he has these little pillow sleep systems that'll pad him in and correct him, almost using, if I can get an example, got a better idea. Right, so I'm correcting my camera a little bit here. It's my Christmas tree. These are sleep systems. So these are really fun. Not so fun. So this would be, oh my God, like here to correct but force his look how weird I know. To force and correct the spine from not. Obviously it'd be much more betterly placed, but hey ho. Also, not an OT, but from my experience, this is what we've used to prop him up to minimize the spine from bending. It's yeah, it's not gonna, what they've always said to me is it's not gonna correct it, it's not gonna make it better, it's just going to lessen slow the process down, the spine bending even more. But hopefully it doesn't get any worse. That's just what I'm trying to explain on that side of things, because no one wants that. It's not fun. It's always constantly an obstacle. But we try and do what we can. So the other, again, I'm going to give you a bit of a warning with this one. Picture's quite not nice to see. It's sad to see. But the struggles we'd have with pompe disease, with eating food, is another big sign and an experience that we did not enjoy. Again, it's going to be another can of worms of how Manchester took a while to even do a gastro. He was on his NG for 4 years, knowing full well he's never going to eat, he's never going to have anything. But the surgeons took 4 years to do the procedure. It was ridiculous, and in the end it wasn't even them, it's all the hay who ended up doing it. I was fuming because, as you can see in this picture, very anorexic, very thin, because he kept on aspirating, because the NG it goes right down the back of your throat. So when my son would cough, and I like a normal cough, that wire would go up and down the back of his throat, which would make him vomit, you know, which caused aspirating. Chest infections, which he was quite in around 2015 to 2016, he frequently had, and was just poorly, and I mean poor, on a ventilator, but also poorly. And I strongly stress that I feel like that NG just didn't help, because as you can see in my later photos, I may throw that in there, cute little chunky monkey now since he's had his gastro. It's been amazing. He's since he's had his gastro, he's had put on weight normal. But again, these are the other signs with pompe, and what we experienced is that they struggle to have food in, and the NG does help for about 6 weeks, as we learned. For about 6 weeks, that's what they're meant to be on with the NGs, not 4 years. It took 4 years. It took me to go to PALS for them to do anything, and I lived for those 4 years. I lived in the hospital for 2 years. Manchester, I couldn't leave because he was always sick and he was always poorly. We lived in the Mac house, Ronald McDonald, and when he was better, it took time to get things back on track, and then we'd be home for a month, and then we'd be back in for about 5 to 6 months with a chest infection. And it's just that constant back and forth, my son, not getting that chance to recover and then have the surgery, but then constantly, you know, getting back and forth. And it just got to the point where all the hay were just like, we'll just do it, and they just did it, and they did, you know, again, it was fab. And then since then he's not had nowhere near as chest infections, because he's not been aspirating on a tube that's been at the back of his throat causing him to vomit. It's just all these things. It's just really, I think if I overthought about how I could have done things differently, I'd go crazy, because I just feel like it's common knowledge for a doctor, for a hospital, to just go, this patient's been on this NG for a while, he's got chest infections, I'm not smart enough to know we need to get a gastro pronto right now, get it in before we discharge them home again to come back with a chest infection. Let's just get it done. No, none of that. You know, again, I was young, naive, very young. It's my first child. I trusted them, and this is, again, a lot of the, I don't want to slander, and it's not a negative channel, but I do really want to emphasize that the trust is difficult. And when you have a child like my son with pompe, these are the hurdles that us parents and possibly new parents will have to go through, especially with doctors, with arguing your point and getting listened to. And again, I just cracked on with things, and I feel like people like to be complacent with that. Certain professionals, I have amazing doctors that I love. They're fabulous, on the ball. They're like, we know what we're doing, we've seen this, no, we're going to do this way, cool, what's mum said, cool, we're going to agree. Also do and agree and work with the mum, which is all you want. We know we're wrong, we know we can be definitely wrong, we're not doctors, we're not professionals, but when you have that doctor who has that balance, that understanding and balance, the child doesn't get to suffer. That's just the issue. You know, the parent isn't coming back and forth to hospital trying to argue that. The doctor isn't getting frustrated at the parent because we're looking overly emotional because our child's sick. It's like, no, we're here because we're not being listened to, and we're back here because the issue didn't get addressed. You're just ignoring it and just making it as a what's it called, a minor acute respiratory tract arrest, which does happen. It does happen, but when it's stuff like a tooth in the lung, or the child's aspirating because the NG hasn't been done yet, back and forth is an issues. Or like this week, he's been in hospital for about 4 weeks out of 2 years of not being in hospital, which is good. He ended up with a proper chest infection, and he had a blood infection, and that was her another stress. They wanted to send him home on an IV with a blood infection. You want to send a ventilator child on an IV with a blood infection? That's not safe. Would the average person want their child, like the average child who didn't have pompe, normal circumstance, child has a severe blood infection and is going to send you home with an IV, and you know what, the hospital from home care can come and give you the IV medication? No, I'd rather the child stay in a hospital environment, so it's a safe environment. So if anything was to abruptly change within hours, you've got that red button in that hospital room that you can alert the nurses, and they're already on it. Why? I don't know why. I just feel like some hospitals are just either, it's not the truth, it's my assumption this is, I feel like they just assume the parents can just get on with it because we've got a care team. I don't have much of a care team at the moment. It's really lacking right now. So we're pretty much on our struggling with lack of care because of the staffing situation, which doesn't help. And then you want to send them home to the parents because even though we're not staffed, but they think that we're staffed because we've got a care team. It's like, we don't have a care team, we're struggling. And then I've got to juggle all the kids, be a mother as well as a carer, because at the end of the day, it's 2-to-1 on the ventilator. I've got to be a mum and a carer to my son and the other 2 sprogs that I've got, and try and be functioning, which we are. It is hard though at the same time, not gonna lie. But yeah, stressful. So these are the other previous screenshots that I've got as small examples. Some of this channel will consist of mostly of this and conversations like this. I'd like to try and not put too much of my son on this and my children on this. There are some videos of me and my kids on this, but it's not the main focus. It's the main focus of these conversations. I hope I get feedback and maybe podcasts with conversations with other parents and children who have been struggling with this. It's something I'm working on now on this channel to try and upbringing. Other parents with pompe, other parents who doesn't have pompe but has a muscular vulnerability or a similar condition or a different condition, but it still is, it's a hard life, parents like this, because I feel like some stigma of when you say you've got a disabled child, which I've had, and discrimination over the many years, is when I say I've got a disabled child, people just assume, he's ADHD, or you got social workers, you're a bad mum. No, he's on an end of life machine. He comes home with that. Yes, he does come home with that. And people seem to go, it's like, end of life support machine. Yeah, it's, unless you've been open to this world, which I understand and respect why they're shocked, but at the same time, when I say disabled, I'm not just saying he's got autism or ADHD. Educate, that's all. That's all I'm here for, is to educate, not judge. Try not to judge. I'm human, not perfect, I'm a dickhead. I'll admit that. But it's educating. It's just trying to positive form of it all. I mean, last weekend when we got him back from hospital, we had a lovely Christmas party, which I might throw a picture of, a Christmas party at Clare House Christmas party. That was lovely. We do our best. I hope this helps, or ask questions, or if you don't have a child who's got pompe, but questions are there, ask away, I'll answer them. That's what this channel is for. So bye, thanks.